Chromium process.
Right there.
Iliac crest.
Right here.
Asius.
Right there.
PSIS.
Right here.
Spinal alignment.
For this, you just palpate down their spinous processes. And then if there's more than one in a row that is out of alignment, they could have scoliosis, but Shayna is good.
Scapular position.
For this one, you'd want to use both hands, but I can't really. And then you'd want to palpate the inferior angle of their patella, or not their patella, their scapula. And so you do this on both sides at the same time, and you just want to compare the height bilaterally. So next, I'll do medial longitudinal arch. So I'll have you come over here and turn around. Have them stand 4 to 6 inches apart, and then just look at their Achilles tendon. And hers both look pretty straight, but if they were to cave inward or bow inward, then it would be pes planus, and if they were to bow outward, it would be pes cavus. I'll have you lay back down on the table. And now I'll do rear foot angle. So for this one, we already drew the lines on. You want to put the fulcrum in between the two lines, stationary arm following the upward line, and the movement arm facing the downward line. And then you just want to look at it. And she's at about 5, which is in the normal range of 2 to 8. So now I'll have you flip over so I can do tibial torsion. For this one, I'm gonna put the fulcrum down here, and then the stationary arm parallel to the table and the floor, and then you want to bisect the two malleoli with the movement arm. And hers is at about 16, which is in the normal range from 15 to 18. And then next I'll do Q angle. So you want the fulcrum right on the middle of the patella, stationary arm pointing towards the ASIS, and then the movement arm following the tibia. And then she's at about 16, which is in the normal range for women, less than 18, and then for men, less than 13. And if their angle is greater than that, it could cause patellar maltracking. So next I'll have you flip over for Craig's test. So first you want to just palpate, let me hold this. Palpate the greater trochanter, which is right about here. And you grab their ankle and you just invert and evert the hip so you find that angle it like protrudes the most, which is about right there. And then you want them to hold that. And then you want the fulcrum distal to the knee, the stationary arm straight up, the movement arm along the tibial shaft. And then she's at about 13. So she would have femoral retroversion. She's less than 15, and if she's greater than 15, she'd have femoral anteversion. So next I'll have you stand for pelvic angle. And then cross your arms. Cross your arms across your chest. And then put the fulcrum by the PSIS, the stationary arm, lateral to the floor. And then the movement arm, you just want to line up with the ASIS. You hold that. So she's at 8, which is in the normal range of 8 to 10. If she had less than 8, she'd have posterior pelvic tilt, and if she was greater than 10, she'd have anterior pelvic tilt. Next, I'll do muscle length assessment, so I'll actually have you flip over. First, I'll do gastrocnemius. So for this one, you want their foot off the end of the table, and then just bend or plantar flex or dorsiflex the foot as far as it can go. And then for this one, if they're less than 10 degrees plantar flexion, it'll affect walking. If they're less than 15, it'll affect running. And then also tightness of the gastrocnemius can cause overuse injuries in the ankle, foot, and in the knee. So then I'll do soleus, so we'll do the same position. This time you want to bend it to 60 degrees, plantar or dorsiflex, and then for this one it's the same implications as the gastrocnemius. Next we'll do hamstring groups. I'll have you flip over. And then you'll put their leg in a 90-90 position, and then support at the hip. You want to extend as far as you can. And then for this one, if they're greater than 20 degrees of flexion, then that could be tightness of the hamstring, which would affect the knee, thigh, hip, and spine. Next, I'll have you flip over and I'll do the rectus femoris. So for this one, you just flex the knee as far as it'll go, which is not good at all, Shayna. So for this one, if it's a greater than 10-degree difference between the two knees when you do it bilaterally, it's tightness of the quadriceps, or I guess the rectus femoris in this case, which would also affect the knee, thigh, hip, and spine. And then next I'll do scapular position, so this time you can stand. For this one, you would want to measure. So you'd want to put a line at the T3, and you'd measure to the about middle of the scapula, and then you do that both ways. And then you'd also do T7 to the inferior angle of each scapula, and then the normal value would be like 5 to 7. If there's greater than 7, then it would be protracted scapulas, and if it's less than 5, it would be retracted. And then if the lower measurement is greater than the upper measurement, then they could also have upwardly rotated scapula. So now if you lay down on your back in a hook lying position, and for this one we'll test the latissimus dorsi and the teres minor. So you actually have to scoot down a little bit. So hook lying position, and then the affected arm, you just want them to bring straight back and try and get it flat on the table. And for this one, she is flat. So if she can't do that, then it would be shortness of the latissimus dorsi and the teres major muscles. Next, we'll do same position, but you can put your hands behind your head, cross them behind your head, and you stand up here, and then have them try and put their elbows flat on the table, which she got. And then if they don't reach the table, it would be tight pectoralis major, which can cause rounded shoulders. And then for the last one, we'll do pectoralis minor. So you have them in the same position, hands at their side, and then you look at their shoulders, and if the posterior shoulder Doesn't touch the table, which hers does. But if it didn't, it would be tight pectoralis minor muscle, which can also cause rounded shoulders.